introduce Kara Welke. She is the owner of Home Therapy Solutions and has been an occupational therapist since 2000. She holds a certificate as a certified aging in place professional and a senior home safety specialist. She's also certified in Skills to Care, which is a program for individuals with dementia and their caregivers. She's worked in a wide variety of settings and has developed and started a variety of programs over the years. Her passion has been working with older adults and helping them be as independent as possible in their daily life. Kara started Home Therapy Solutions in order to help older adults receive the services and care they need in their natural environment. Her goal is to help as many people as possible stay in their homes as they age while maintaining their optimal health and
objectives today. We're going to describe the impact of falls and the costs associated with falls. We're going to identify professional screening options for falls that address Medicare and CDC guidelines. We're going to describe Medicare and CDC guideline recommendations for interventions. And then we're going to focus a little more specifically on understanding the evidence for OT home safety evaluations and the process that is involved. So objective 1, impact of falls and the cost associated with falls. And I'm guessing most everyone in here can answer this without me even going through it, but we'll talk about it anyway. So 1 in 4 older adults reported falling in 2018, which is 36 million falls. By 2030, it's expected to be 52 million falls. 55% of fall injuries among older people have occurred inside the home, and 23% of fall injuries happen outside but near the house. Adult 65 plus, what do you guys, and type this in the chat section, what do you guys think the total medical costs for non-fatal falls were in 2015? Just estimation. We'll give a few times for people to plug in your answer. We have 2 billion, 70 million, 3 billion. Okay, good. So in 2015, it was $50 billion. Now, let's look at another stat. For adults 65 plus, how much do you think was spent related to fatal falls? Go ahead and put your guess in the chat section for that. Anyone have a guess? 150 million, 100 million, 25, 75. Okay, so for amount spent related to fatal falls, $754 million. But there are a lot of other costs of falls, not just particularly money. What do you guys think are other costs of falls? If you guys can share in the chat section some different things that you guys think happen because of falls that are costly. Great, loss of mobility, having to go to rehab, lost work time, lifestyle changes, decrease, yeah, hold on. Perfect. Loss of work for family and caregivers, extended hospital stays, resulting comorbidities, loss of independence. Yeah, there are tons of them. And we're not gonna even, I don't even list half of those on here, but we're just going to talk about a few of them. So 800,000 patients hospitalized because of a fall. 1 out of 5 falls equals serious injury. 300,000 hospitalized for hip fractures. Falls most common cause of a traumatic brain injury. And then increased fear of falls equals less active, equals increased weakness, which then leads to a ton of things like you guys mentioned, and I didn't even put them all in here. But decreased social participation. I mean, how many of you therapists out there see your clients who have fallen and now they they don't want to do anything because they're scared of falling, and it just creates that spiral, right? So they don't want to participate, they get depressed, they're lonely, they maybe develop anxiety, and then when they don't want to participate or do things, now they're sitting all day, and now they can't stand, now they can't dress themselves, and then it increases caregiver burden, and it's just kind of a vicious cycle. Let's see what other things. I think we covered all of that. So I think we all know that falls are a huge problem, and that we all really need to work together in order to help decrease and minimize falls and help those that have fallen to help minimize future falls. Objective 2 was identify professional screening option for falls that address Medicare and CDC guidelines. So I thought this was interesting. This was from Assessment and Management of Fall Risk in Primary Care Settings in 2015. And I'm pretty sure we probably all can assume that a lot of people don't always talk about their falls, or they don't think it's a fall. How many of you guys have, like I have clients that they're like, well, I just sat on the ground. Well, did you want to sit on the ground? But less than 50% of older adults who have fallen talk to their providers about it. And guidelines state that providers need to ask about falls at least annually. And 3 key risk factors need to be addressed. Balance, medication, and home safety should be addressed in everyone that is high risk. How many of you guys are familiar with the STEADY initiative? If you could put yes, if you are familiar with the STEADY, that would be awesome, because it'd give me an idea. If you're not familiar, if you could put no, that would be super helpful. Because if you're not familiar with the STEADY, after we're done today, I want you guys to go to this website and look at all of the fabulous resources they have. And also you can order, they're free. I have a stack of resources from STEADY. They sent out a toolkit preventing falls in older patients. They have tons of different resources, brochures, and everything that we can use in practice. And all of us therapists should be well familiar with this program, as well as healthcare providers and so forth. And I know for home therapy solutions, we've connected with a couple places in the Grand Forks region and are in the process of putting together a
I know that they're going to want to see my ID.
And we utilize, a lot of the STEADY materials, and I'll show you some of them as we go through.
What street is that place on?
With the STEADY initiative, it's stopping elderly accidents, deaths, and injuries. They talk about screening and then assessing. So with screening, they have brochures that you can utilize, and they have questions that need to be asked to everyone in the screening process. And then they talk about the importance of assessments, and they talk about gait, strength, and balance tests. And for all of the PTs and OTs, the ones they have in there are, I believe, 5 times sit to stand, the tug, and the 4-stage balance test in there for sure. And they talk about the importance of identifying medications taken that increase falls risk. And as a age-friendly healthcare system, our therapy for home therapy solutions, we need to address all of the 4 M's. And one that we provide is a handout called the 10 medications older adults should avoid or use with cautions. So obviously as therapists, we refer to, the physicians and so forth for that, but this is a nice handout that we can provide to clients regarding medications and so forth. You see that it says ask about home hazard.
How am I going to do this?
One that we're gonna, sorry, there's some mic. I don't know.
Sorry. Could you please, if you're not muted, could you please mute
I don't
yourself?
know when to get the stuff over there. I'd rather just do it that way, Mira. You avoid all
There
the
we go.
problems.
Got
Here we
it.
go.
Sorry about that.
Okay, no problem. So, so identify medications, ask about home hazards. So we're saying like when they come into like a clinic setting, we should, the provider should be asking about home hazards there. Measure orthostatic blood pressure, check visual acuity, assess feet and footwear, assess vitamin D intake, and identify comorbidities that increase falls. And these are all based off of the STEADY coordinated care plan. And this doesn't come in very well, I apologize, but if you go to STEADY, you can look at everything. But they have the algorithm for falls, risk screening, assessment, and intervention, and it takes you through the process where we need to be starting, and they highlight that we need to be screening for fall risk yearly. And then it goes down to screen not at risk, screen at risk, and then interventions and so forth. And just to highlight, underneath there, what we're going to talk a lot about today is the home modification safety. And on the list is actually the home hazards likely and referred to occupational therapy for home safety. And with the STEADY program, there was a study out in 2020. And they looked at evaluating a 2-level versus a 3-level fall risk screening algorithm. So the one I just showed you, 3-level, and then they have a 2-level one that's a little more simplified. And they found that the quick 2-level study is a suitable alternative. And their hope is that it will increase fall prevention programs because it makes it easier, just one less step, and leads to decreased risk of falls for older adults. And this is what that algorithm looks like. So basically for patients 65 above, you ask 3 key questions, you administer the tug, the timed up and go, which for those of you guys that aren't familiar, they stand, walk 10 feet, walk back, sit, and it's timed, and observe the patient for gait or balance. And then you have a no or yes and move on for there. So it's a little simpler screen, but anything we can do to get this out there in more settings would be awesome. And then, like I was going to show you guys here, see if I can make this happen with my. So with the study, tons of information's on there, but they even have continuing education programs as well. And they provide online training for falls prevention, but they have lots of resources, videos. The coordinated care plan is something you're definitely going to want to check out. They have tons of brochures, and again, for you professionals out there, you can order the toolkit and brochures, and there's no charge, and they will send those to you. So highly recommend that you guys utilize that. Okay, pop back up. Sorry, let's fast forward here. And if you have any questions as we go, let me know. Okay, so we talked about importance of screening, and then make sure you check out the study resources. Objective 3 is describe Medicare and CDC guideline recommendations for interventions. So what kind of interventions do you think are recommended to help prevent falls, decrease, reduce falls? What have you guys heard out there for interventions that are beneficial? If you guys can put in the chat section, that would be great. Home safety eval, equipment training, strengthening, medication reconciliation. I was talking about that with a client this morning. Caregiver training, education, no rugs, adaptive equipment, outpatient visual assessment, balance training, mobility, exercise, yoga, diet issues. Good, yeah, there's tons of things that that can be done. Good, okay. So these are the recommendations from the studies program. So they recommend physical therapy for gait and balance exercises. They recommend community falls prevention programs. Are any of you guys familiar with any community falls prevention programs? If you know of any community-based falls prevention programs, feel free to post them below. So yep, Stepping On's one. If you know of any others, feel free to put them in. And then just highlighting home safety evaluations by occupational therapists, addressing postural hypotension, bone builders. Kimberly, were you in the, Kimberly's a previous student. We did a community falls prevention program in the OTA program way back, and it was a community-based falls prevention. I cannot think of what it was called, mobility something, but there's quite a few different ones out there. Assess and manage chronic conditions, talk about falls risk, and engage client to develop a falls prevention plan. So again, if we can just every appointment talk about, falls risk and ask those questions would be really helpful. Ensure client has a plan to help with reducing falls. Referrals to specialists such as ophthalmologist, podiatrist, vitamin D supplements. So these are, again, there's a lot of things out there. There's research on different programs depending on client diagnosis and so forth. Like Abigail mentioned, the Big and Loud. I love the Parkinson's Wellness Recovery Program, the Ohio Health Delays the Disease Program. There's lots of different things out there. So when people are falling, we need to get them, I obviously am a huge believer in physical therapy and occupational therapy, but we need to look at all of these other things as well. And that's why with the STEADY program, they really promote that team approach when we're looking at someone that's falling. So we're going to move into objective 4, understanding the evidence for OT home safety evaluations and the process involved. So again, everything is important. And today we're going to talk a little bit more about, or we're going to focus really on the OT home safety evaluations. And just curious, do you guys feel, OTs, PTs, other healthcare professionals, do you feel that we are getting enough referrals to complete home evaluations? Yes or no? And it might depend on what kind of setting you're at. But okay, good. I just want to make sure that I wasn't gonna, because I do not think we get enough home evaluations at all. And that is one reason why I love what we do is we provide therapy in the home. So we're in the home every day with our clients and are able to address the safety concerns, on a daily basis. But I worked in a skilled nursing facility, transitional care unit, and I personally always wanted to implement a program where we did like a home eval early on so that we knew what exactly was going on in the home environment. So when we were working with them, we could work on those things to help them be able to do what they needed to do at home with that. But I just think there's a lot of, we can really get out there and do a lot of home safety evaluations and help minimize falls in the home. Okay, so there's actually quite a few studies out there, and I finally had to just stop. So we're going to talk about a few today. This is a systematic review done in 2018 on occupational therapy fall prevention interventions for community dwelling older adults. And the resources are in the back, so you guys can pull up the articles because I just highlight little bits and pieces here. But what they found is home assessment, modification, or hazard abatement were part of all of the positive studies that included multifactorial interventions. This is another systematic review in 2017, again on the effect of home modification interventions on the participation of community dwelling adults with health conditions. And they found strong evidence supporting single and multi-component interventions, including home modification interventions. And they found that when home modification interventions were included, that it improved function for people with a variety of conditions, it reduced the risk and rate of falls, and it reduced the demands on caregivers. And I'm sure I'm preaching to the choir again on this one, but when people fall, when people are scared of falling, then caregivers tend to do too much. And then the client doesn't do anything. I have a client right now that the son does everything for him, not any longer, but he was really scared of falling, and the client said that, but he can do things. So really getting in there, seeing what's going on, working with them to help reduce that fear is so important, and helping to reduce demands on caregivers. How many of you are familiar with the Capable program? If you could put yes, you're familiar with the Capable program, or no, that would be awesome. And I do know we have a therapist in here, Dawn, that is actually going to be part of a Capable program. So that is super exciting. You can maybe share some stuff later, Dawn, not to put you on the spot. Okay, wow, I am actually surprised that that many people are not familiar with the Capable program. So the Capable program was pretty huge in the world of occupational therapy. It is community aging in place, advancing better living for elderly. For elders, and it's an interdisciplinary program, and it's in this program, it's a registered nurse, an OT, and a handyman. And the registered nurse does between 3 to 4 visits, the OT 4 to 6 visits, and then the handyman's allowed to spend up to $1,300 in home repairs, to make modifications, to purchase assistive devices, and they all work together in this program. And it's evidence-based. There's research out there for it. And originally I saw some places a 4-month program, but last night when I was looking, it looked like it was a 5-month program. So Dawn, if you know any difference, you can let me know. Oh, okay. Okay, sounds good. And this Capable program addresses, the home environment, and it's designed to increase mobility, functional ability, and ability to age in place. And it is a national program. It was started at, Don, help me out, was it John Hopkins? I think, yeah, John Hopkins. And they have there's one in Iowa, I think is the closest to our area, but it's kind of spreading throughout the United States. And the program costs an average of about $3,000 per person. And from what I could find out, like whoever gets a grant or runs or funds this program, they have to have this amount of money for this. So, and again, I'm not an expert on this, but anyways, overall, the program cost is about $3,000 per person. And they've found that they've had a $22,000 reduction in Medicare cost over 2 years with this program. And they found that it helps to increase function, lowers hospitalization, and nursing home rates. But again, I think this Capable program is awesome, but it also shows that by us, everyone on here working together, that we can help do this as well by, getting in that home, doing the assessments, connecting with resources and so forth to make this happen. But it'll be exciting to see how this program spreads throughout the United States and beyond. And I didn't mention this, but the lower income adults average improvement was they had like a 50% reduction in their degree of disability. So great program. Be sure you check that one out. And maybe some of us will be able to bring something like this to our area. This program, this one is a little older, from 2005, but you'll see why I kind of like this one. It's a randomized control trial, prevention of falls in people aged greater or equal to 75 with severe visual impairment. And it was called the VIP trial. And they had 4 different groups, just the home safety program, I never pronounced this one right, Otego exercise program, and vitamin D supplementation. They had a combination of the home, mistake there, of the home safety and exercise program, and then one was just social visits. Out of these 4 on the screen, what do you guys think they found that had the best outcomes? Anyone want to take a guess? Combo. Okay, awesome. They actually found that the home safety program was the most cost-effective and reduced falls. And they found that the key elements were the OT's advice rather than the environmental changes were the key part, and that a trained and experienced OT is critical to the success of this intervention. So you can kind of see why I like that article, because it helps to support occupational therapy, and that it is really important. And it's not just, making the changes, but the advice and the training and everything that goes into it. Here's one, this is another older one. Home visits by an occupational therapist for assessment and modification of environmental hazards. And it was a randomized trial, but it is old, 1999. However, it shows that we should have been doing more of this for a long time, I guess. But the intervention was a 1-hour home visit by an OT, and they assessed for environmental hazards and facilitated necessary home modifications. And their results were that the intervention was effective among subjects who reported having had 1 or more falls in the year prior to the study. And 50% of the recommended home mods were in place at 12-month follow-up. Here's another one from 2011. They had an OT or a home care worker completed a home assessment intervention. And the intervention was only effective when implemented by OTs, and the fall rates reduced by 46% of those with assessments completed by OTs. And I will say that there are lots of people out there doing home assessments, home safety, may not be therapy professionals at all. And, I'm a big advocate for, OT and PTs too. There's physical therapists that do this area as well. And we'll get into a little bit more about why OT specifically is able to have a little different lens or viewing point when we're in there in the home. Now, this study was just shared in our community like a few weeks ago, so it was kind of perfect timing, actually. So this is the unmet need for equipment to help with bathing and toileting among older U.S. adults, and 2,614 community dwelling older adults, and 42% of individuals 65 plus lacked grab bars or bath chairs to help them bathe and toilet. More from this study, they noted that if clients are having increased impairments of falls, providers should ask about their home setup. There are home safety assessment tools that can empower clients and caregivers to identify hazards and the solutions. So yes, there are tools that you can download off the internet and go through the house. But they did note in the study to have an OT complete a home safety assessment and work with professionals on installation. how many therapy professionals out there that do home safety evaluations see the most scary installations of adaptive equipment out there? They really need to be done by professionals or people that know what they're doing, instead of someone just trying to stick a grab bar in the wall haphazardly. If you've seen anything, please share, yes, I have, or anything you want to share with that. So we see some interesting things out there. And then, work with professionals on installment. Let's see what else from there. Also in this article, they talked about why older adults do not have the equipment they need. And these are the things that they talked about. One, they do not know when or what equipment they need. They do not know how to get the equipment and or how to install it. People are not familiar with services available, and adults do not get taught what they need as they grow old. I love Chris's comment. It is terrifying. Duct tape does not fix all. That's awesome. And let's see who said this. Kenna definitely came across some sketchy attempts. Yes. Low lawn chairs as bath chairs. Yeah. Seen it all. And then they also talked about few physicians are skilled at identifying disability that warrants equipment, asking questions about the home environment, educating on available options and making recommendations, and referring clients to the solutions they need. And the thing is, there are so many resources out there to get this equipment for no cost or low cost. So we just need, and I think that, well, at least myself as an OT, I sometimes think everyone knows about this stuff, that we all know about grab bars and toilet seat risers or things like that. But obviously people do not know things that are out there. I recently went to an apartment complex that was built for older adults. They market themselves as a community for older adults. Okay, I could hardly get off the toilet in the apartment. The showers are set up so that there's no way to put grab bars in there. Like I had the professionals come out and we were talking about that. It's just crazy kind of the situations out there. But we have lots of great resources in our state, loans, grants, I don't know that I put this picture in. Oh, maybe in the section. Like I had a family that got a $6,000 grant to redo their bathroom. I've had some $2,000, but there's lots of funds out there. There's grants, there's equipment, lots of great programs. So it's really important that everyone knows all about all these resources in our communities, and that we also work with our primary care providers to help them identify like what questions to ask and when to refer to occupational therapy professionals for that home safety eval. I personally think most all clients, older adults, could benefit from a home safety eval. And Sue Doyle is on here, and she's actually my mentor and helped with this presentation. And she shared this study with me last night or the night before. And this one is on handicap accessible homes may improve brain function in seniors with disabilities. And I know personally, I tend to think about how it improves physical function and forget about how it can help improve cognitive functioning as well. So this study mentioned that 70% of older adults live in homes without any accessibility features. Those who live alone and have a disability have quicker decline in brain function. Less than 4% of housing have single floor living, no steps in the house, and appropriate size hallways and doorways. And yeah, I just did a universal design course on Friday, and we talk about this all the time. And like my house is the worst. We have steps everywhere. It's awful. Researchers know that accessible spaces improve physical health and reduce falls, but that doesn't always mean that it's happened. And I actually work with a contractor, and I was like, why don't you guys just build accessible houses from the beginning? And he's like, well, it's cheaper, to do what we do. And they don't often want to think about that or add the additional expense, but it's just like if we could just start from the start and have no barriers entering the houses and so forth. Because it's not just for older adults, it's for all of us. But anyways, let me see. Older adults who had at least one accessible feature were less likely to have brain function decline or memory loss. And home environment has direct effect on mental health as well, not just physical health. So thanks, Sue, for sharing that study with us, because I thought that is very good. It's not just physical health, it is mental health, physical health as well. Yeah, and as Sue said, it's not really much cheaper. It just takes some forethought, and we'll probably try to do some more presentations in this area as well. And Sue actually is been building her own house that is 100% accessible. So this is from AOTA, because I have, focused really on occupational therapy. And they just talk about how OT practitioners have long established proficiency in addressing the impact of the environment on occupational performance. As such, home modification recommendations and services fall well within the scope of occupational therapy and are recognized in most state practice acts. And when home modifications are part of a skilled plan of care, they can be a covered service under Medicare. And there are other ways to cover home modifications, and that's a whole nother topic out there that I won't get into today. So home evaluation process, why OT versus another professional? And I know this is kind of hard to read, sorry. But OTs are skilled at evaluating how the environment affects how people participate and perform their daily activities in that environment. They're skilled at identifying barriers in the environment to occupational participation and performance. They're skilled at identifying modifications that can improve the participation and performance. They're skilled at analyzing and evaluating how the person performs. Because I will tell you, there are some houses that I go into that I'm like, but sometimes a person does great in them. So we need to see the person and how they participate and perform in their environment. They know how to find the right fit to maximize independence and safety and minimize compensation. Now, I think we tend to compensate way too much, and there's research out there that we do compensate way too much. And sometimes family thinks they're really helping people by bringing in all this adaptive equipment that's not needed, and now they no longer stand or do anything because they have everything that lifts and does everything for them. So we really want to find that best fit. When an OT comes into the home, we provide more than just modifications, also client and caregiver training, referrals to other providers, determine appropriate adaptive equipment or durable medical equipment, and even if it's needed, evaluating their performance of daily activities in the home allows us to determine what their needs really are. Understanding the progression of the disease to make appropriate changes now that do not need to be modified in the future. I'll give you an example. I just came upon a client with Parkinson's, and I happened to see some drawing plans sitting on the table. And I was like, what are you doing? And they were doing a major renovation, but it wasn't going to be a good long-term solution for him, knowing the progression of the disease. And hopefully the OTs are familiar with a variety of methods and sources to obtain equipment, grants, funding, etc. for this. I always said you need to be very familiar with everything in your town, city, county, community, state about the funding, grants, things that are out there for your clients. Home evaluation process, this is pretty generic, but depending on the state and the funding source, a doctor's referral may or may not be required. If it's a Medicare client, we have to have the client sign off on the plan of care for Medicare rules. Depending on the client's insurance and the client situation, it may or not be covered by insurance. And yeah, like Kathy said, the assessment can be covered under Medicare, but not most of the actual modifications. But that's when it comes to knowing some of the grants and resources that are available to help with those modifications. Occupational therapists need to be skilled in the home evaluation process, requirements, and available resources in the community and state. Again, we complete the initial eval and then determine appropriate next steps. And it's so important that we work with the entire team and the family during the process, because they have to obviously buy into it as well. Okay, I know I'm flying through and we only have 15 minutes. If you have questions, throw them out. Otherwise, we're gonna do a few case studies and just kind of talk about a few situations out there. So the first one we're going to talk about is a 94-year-old male, pretty extensive diagnosis or history, medical history. He has assist with medications. He has assist with his catheter. He has assist with shower, but he can transfer himself. He can dress himself. He does have cognitive impairment. His routine is he gets up between 6 and 7 and just sits in his recliner all day, watching TV. He lives with a spouse who has dementia, who has significant behavioral concerns. And she's actually a hoarder, which hoarding leads to increased risk of falls, which he did fall recently again because she has boxes everywhere. He was at the hospital, went to the nursing home, and then went to home. And I'm just showing you one little example of the bathroom when I first saw him in his home. And I will say he has had multiple therapists in and out of his home environment before. But what I want you guys to do is look at these 3 pictures of his bathroom, and let's start with identifying the concerns you see for this client in this bathroom. Go ahead and put them in the chat section. Okay. Good. No, needs a bench and tub, toilet, no suction grab bars. Glad you noticed that. Clutter, low toilet, placement of grab bars, clutter, mat and tub. Okay, yeah. Awesome. So this green bath mat was a death trap. I mean, whoop, completely slippery, horrible. That grab bar, suction grab bar, pops off the wall. I mean, horrible situation. The toilet grab bar, I don't know, I know someone said placement of grab bars, but the toilet grab bar is back and it's kind of hard to see, but it's way up high. It's like he would need to do pull-ups from that grab bar. So not appropriate situation. And you guys all noticed the rugs. Did anyone state, yeah, no, did anyone state there's no, like handheld shower? You guys talked about the tub bench. So the spouse does not like anything changed. In fact, she gets very, very mad and was able to get that grab. Well, and the funny thing is, I mean, those of you that know me, I pretty much, so I took the green mat out and I rolled it up and I stuck it. I didn't throw it away, but I stuck it somewhere. And then I swear the next day I came back and it was rolled out and put back out there. But we got rid of the green mat. He does have, he did not want a tub transfer bench, which I recommended and put in, and the wife was adamant about it, that she did not want it, but he is using a shower chair. We recommended appropriate grab bar placements, getting rid of the rug, the supplies. But with this situation, the other thing is unfortunately, we can't just go in there and do everything we want because we're dealing with a client with dementia that really struggles with things, that gets mad at anything. But we did make improvements within there. Do you guys notice any positives? I honestly don't really have any positives on this one, but that's good that it looks clean because it's actually really not. And I don't know if you see the catheter bottle on the floor and that dirty tub thing in there. And yeah, he actually can step over the tub good, but he doesn't have a grab bar to hold onto that's safe when he does it. Sorry, my dogs are in the background. Okay, so any questions on this one, let me know. They have a toilet that flushes. I love that. That's awesome. Sorry, I better shut my door. Okay. Next one. This one is an 86-year-old. A lot of heart issues going on. And she was passing out, history of falls. Actually, before I saw her, she was in the hospital and she had passed out and landed in a tub and woke up finding herself in the tub. She's had several recent hospitalizations. She was living in an independent living apartment and she actually moved to a condo with her spouse, but she preferred the independent living apartment because she could get out and walk up and down the hallways. Her spouse assisted with the shower. She can dress herself. She could walk short distances with a four-wheeled walker, and total assist for all IADLs, just poor endurance, poor activity tolerance, and just not feeling the greatest. She does like to be around people. She likes to walk, and so forth. So here is her bathroom. Okay, so let's start with the concerns. Do you guys see any concerns in this bathroom? Okay, wet floors, shallow looking seat to sit on and shower and easy to slip off of, slippery floor, all the floor tile, possible drainage issue, wipes hard to reach, floor pattern, slippery tile, busy floor, no containment of water. Okay, good. I mean, yep. Monica, I'm really glad you pointed it up there because barn doors can be hard to move back and forth. I mean, I like the accessibility part of it, but they can be hard to move. So, you know, when I walk in and looking, I mean, they paid a lot of money to have a professional company do this bathroom remodel. But one of the first things she told me, she can't sit on that seat. She falls off of it onto the floor. And the other part of me is the grab bars are very very handicapped like versus more universal design. And I mean, otherwise, you know, it is very nice. I mean, considering the last bathroom we looked at and this one, but there are still concerns, and getting an OT involved could really help possibly minimize like having a seat where the client's going to fall off on and things like that. So yeah, grab bars may be wet if not appropriately dried off between showers. So, and I wanted to put this in because I know a lot of people, you know, have said, you know, well, yeah, that looks great and so forth. And they have the adjustable mount handheld shower and things like that. But yeah, she's fallen off that a couple times. So vertical grab bar placed too far from toilet, grab bars may be too far away, not close. Yeah, lots of different things going on. So getting a team in and having the therapist involved is really important with this. I'm going to skip the positives because I'm almost out of time and I want to show you this last one. So this is I have two more. Let's see if I can do it quick. This is an 88-year-old, obstructive sleep apnea, cancer, multiple falls, history of CVA. He's in a wheelchair for all mobility. Transfers are min to max assist, depending on the day. Max assist for showers, stands for 1 minute at the most with min to mod assist. Okay, so I walked in and this is what I saw. No asking me about anything. What are the concerns with this brand new bathroom or shower remodel? Thinking about the case study. No grab bars, no seated surface, and there actually are grab bars, and I'll talk about that. Slippery tile floor, no grab bars. Small, no seat, no grab bars, shower head, no hand showers, small. So it is small. Okay, so he doesn't stand. He has to sit on a bench, okay? When he's sitting on the bench, where is the cubby for the soap? No, it's not completed, it's in process. Where is the spot for like the soap, the shampoo behind him and outer breach? Where are the controls for the shower when he's sitting? High, outer reach, no adjustable handheld. And I wish I would have taken a picture because I waited around until the people were coming to work on this bathroom and they showed me where they were going to put the grab bars. They put the backing in for the grab bars to be like, 2 to 3 feet above where they should be for this person who sits in the shower. So again, it's so important that we educate families not just to get a remodel and hire someone that can create a beautiful bathroom or a beautiful shower that's not going to be functional and not going to work for these clients. 3 minutes, I'm going to show you this one really quick. 76-year-old, Parkinsons, history of falls, just had a CVA. Assist levels vary day to day. He was in the hospital this past September. And this is the floor plan that was drawn up for his bathroom. And I know it might be hard to see, and we only have a couple minutes left. But what do you guys see that's wrong with this floor plan? And Dawn, we were able to make modifications with the grab bars at least, but he ended up going into the hospital and I haven't been back in that bathroom yet. Anyone see anything? Yeah, shower entrance. Yeah, that's right, 30 for the shower entrance. What else? Anything else you guys notice? So we have a home safety and modification program and course where we help therapists start their businesses doing home safety and modification. And I have actual pictures of all of this. So Dawn's seen all of this. Anything else wrong with this besides just the shower entrance, only the 30 inches? Shower seat is far from shower head. Plus, some of these shower seats that are installed, I'm personally not a big fan of. So it's really compartmentalized, like the toilet, the small space in the toilet. And then if you would eventually need to do like a wheelchair transfer, so forth, in there. And then just the small space to get into the shower area where everything was set up in the shower was just all goofy. And I was able to catch this in time. There's still some changes I would have done differently. But overall, it's come out really well, except for the toilet they put in was still too low when they're going to have them replaced at. Okay, little plug for therapy professionals interested in home modifications. I mentioned Sue Doyle on here. She does the lead in all of this, but we have a certification program that's specifically for therapists because we believe that therapists are the ideal people to be doing home accessibility and safety. And we have different trainings as well on that. I didn't leave time for questions, but I can stay around if there's time. But you guys, if you need to shut off, that's fine as well. Sorry. But here's my contact information. You can always.
Sarah, there's 2 more questions. In the barn door shower, how would universal design grab bars been better? Oh, I just, for appeal, just for looks. There's like nowadays you can buy like grab bars that don't look like grab bars. They look like towel bars and they don't look like it's a handicapped bathroom. So how can we build bathrooms that are designed for everyone, but they don't look like they're handicapped accessible? So it's not necessarily a functional thing. It's just more of an aesthetic type thing. So the home mod certification course is, it's self-paced. There's 5 different modules. There's live components. And then of course there is actual projects that have to be completed to make sure that you meet the requirements in order to do the best you can to helping clients in the home.